Source: National Business Group on Health, Washington, June 20, 2018. Globe NEWSWIRE, calling the misuse and abuse of opioids a national issue that profoundly impacts employees, their families and employers. The National Business Group on Health, a nonprofit association of more than 420 large U.S. employers, is recommending employers work with their health plans and pharmacy benefits managers, PBMs, to assure they are implementing national guidelines for prescribing opioids. The Centers for Disease Control released guidelines for opioids for chronic pain more than 2 years ago. The guidelines provide clear recommendations for prescribing opioids and managing patients using them for chronic pain. The guidelines cover recommendations for dosage, duration and follow-up, as well as recommendations to assess risks and harms. Despite the guidelines and evidence from clinical research, overprescribing remains a top concern. Similar concerns exist about prescribing opioids for management of acute pain as well. Inappropriate use and abuse of prescription opioids is rapidly becoming a major issue for employers across the country, said Brian Marcotte, President and CEO of the National Business Group on Health. In addition to the devastation it causes employees and their families, research shows opioid misuse costs employers billions of dollars from absenteeism and presenteeism alone, affects hiring and retention, and negatively impacts worker productivity, workers' compensation claims and overall medical costs. While health plans and PBMs have initiated various opioid management programs, opportunities remain to implement the CDC guidelines, and we recommend employers work with their vendor partners to review the guidelines and take action to fill any gaps. Specifically, the National Business Group on Health is recommending employers actively engage in conversations with the health plans and PBMs they work with and ask if their efforts and their work with clinicians include the following: strategies to mitigate risk of addiction before starting and periodically when continuing opioid therapy. Limits on opioid prescriptions for acute pain to short durations. 3 days or less will often be sufficient. Use of immediate-release opioids when starting therapy for chronic pain instead of extended-release, long-acting opioids. Use of the lowest effective dose when prescribing opioids, and avoidance of concurrent prescribing of opioids and benzodiazepines whenever possible. Importantly, a recent National Business Group on Health survey of 62 large employers found 60% experienced at least one issue arising from prescription opioid drug misuse or abuse in the workplace. Some of the most common issues that occurred were increased medical or pharmacy costs for chronic opioid users, 40%, increased absenteeism or missed work among chronic opioid users, 40%, and employees overdosing on prescription opioids, 18%. Given the widespread nature and expanding scope of the opioid crisis, it is encouraging to see employers are taking steps to help prevent its spread and assist employees and their families who may be affected. Employers have begun to ramp up efforts to increase employee awareness of the issue, prevent misuse, and help those needing treatment. These efforts include plan design changes, education, communication and training for managers and employees, and working with health plan partners, said Marcotte. The National Business Group on Health is committed to working with employers to reduce the risk of opioid misuse among employees and their families. This year the organization is hosting a multi-part opioid summit, a series of bi-monthly 2-hour sessions during which experts discuss the key challenges associated with the misuse and abuse of prescription opioids and strategies to prevent addiction. About the National Business Group on Health. The National Business Group on Health is the nation's only nonprofit organization devoted exclusively to representing large employers' perspective on national health policy issues and helping companies optimize business performance through health improvement, innovation and healthcare management. The business group's mission is to keep its membership on the leading edge of innovation, thinking and action to address healthcare cost and the delivery, financing, affordability and consumer experience with the healthcare system. Business group members, which include 74 Fortune 100 companies, provide health coverage for more than 50 million U.S. workers, retirees and their families. For more information, visit www.businessgrouphealth.org. Contact at Emmerman 609-275-5162 Emmerman@eaglepr.com.